The American Psychiatric Association survey found that one of the biggest obstacles to obtaining mental health care for the military was the perception by almost two-thirds of the military reporting that seeking mental health care would have a negative impact on their careers. This is so important. So many of our young men and women who have devoted themselves, put their lives on the line for their country, they deserve and need help for whatever problems they come back with, physical or mental. And we need to help them understand that seeking care really is a sign of strength, and that care works, treatment works, and that this will not jeopardize their careers, but it will improve their lives and their family's life.
Well, my husband deployed to Iraq in 2005, and it was for a year, and I lived here in Virginia with my 2 children, so it was a very long tour and very difficult, and about halfway through I realized that I was having some problems. I had some physical symptoms, and I sought some help for it, and a counselor gave me some really concrete advice on how to help myself, and without it, I really don't know how I would have fared the rest of the deployment.
Well, we've deployed 1.5 million servicemen and women to the global conflicts around the world in Iraq, Afghanistan, and other locations. And we're estimating that a third of those, maybe up to 500,000 individuals, are going to have mental health issues when they return. And as a country, in order to be prepared to deal with that volume of problem, we have to go to Congress to get the funding to support the services that they are going to need in order to integrate back into their community.
The military teaches some very, very important principles and values, honor, integrity, trust, and it's these principles and values that, in my case, I used as resiliency factors to be strong enough and willing enough and trusting enough to get the help that I needed, and to continue to rely upon that to support the ongoing recovery process.
We must expand mental health services for both military and for dependents, for the spouses, for the families. It's something that we just have to do.
Most, even active duty families, most of them do not live on military bases, so we're not just talking about reserve and guard here, we're talking about all military families who need to have access close to their home. Nobody's going to drive an hour to get mental health services that it was difficult for them to admit they needed in the first place. It needs to be easy access.
Stigma in the military, it may be a barrier to accessing care because they feel that it may affect their career in the military. And we want to go to Congress because we don't want other barriers to be lack of funding or lack of service available either in the military for their mental health care or in the community when they're at home.
Yes, I was glad to serve my country. I was glad to be in the Navy. The Navy and I were like one. I very much identified with the Navy. And the Navy and the military in general, I think, has to step up and be accountable enough to talk openly and to provide information that allows the service members to either seek confidentially or directly the help that we need to continue to be healthy and committed fighters.
Well, the survey from the American Psychiatric Association looked at both military members and their spouses and families. And it showed that the maintenance of mental health is a low priority for most active duty. That is, they just don't think about it much. They feel that they're pretty solid, they're good citizens, they do their job, and the maintenance of that is not near as important for an active duty as for their spouses, who kind of perceive that there is more to this than just being a good soldier.
Thank you all for joining us here today. We're here to talk about a very important issue, that of ensuring that our military troops, who risk their lives every day for our country, as well as their spouses who support them, that they can understand how to take care of their own mental health. And furthermore, we want to be able to know that they have the access to the resources that are needed to accomplish that task. I am Dr. Mary Helen Davis, a member of the Board of Trustees of the American Psychiatric Association. I have chaired the APA's ad hoc committee on military and veterans affairs, as well as Carolyn Rabinowitz, president of the American Psychiatric Association. Dr. Rabinowitz has served many leadership levels on a national level, both within the American Psychiatric Association as well as the American Medical Association, and currently serves on the AMA's Council on Scientific Affairs. Dr. Rabinowitz is former dean of Georgetown University School of Medicine, where she also served as associate dean for students and professor of psychiatry. Dr. Rabinowitz is a clinical professor of psychiatry at George Washington University School of Medicine and is an active and beloved clinician active in the practice of adult and child psychiatry. Dr. Rabinowitz.
Thank you very much, and it is my honor and pleasure to participate in this event this morning, and I'm particularly pleased that I'm here with NAMI and with the National Military Family Association, because we cannot do this alone. And I'm pleased to also